Good morning, Peter Goertz. I'm a psychiatrist here in New Orleans on a beautiful morning. Should people be free to harm themselves, or do they need to be involuntarily psychiatrically hospitalized? A patient illustrated this issue or aspects of this to me. I'm not fond of the notion of forced psychiatric treatment, but often I don't know what else to do to try and help a patient. I did not go into medicine to become a lawyer. And the issue I mentioned has legal aspects. So is it legal to prevent someone from harming themselves? Ethical aspects, is it ethical to prevent someone from harming themselves? Medical aspects, do we need to intervene? Is it necessary? Medically, psychiatrically, do we need to intervene? Is that necessary? And then, of course, there's the financial aspect, insurance aspect. It's very expensive to hospitalize people, especially for lengthy periods, which doesn't happen that often in psychiatry anymore. So overall, from a psychiatric perspective, this issue to me is very interesting, not just psychiatrically, but like I said, legally, etc., but also sad emotionally to me. The patient I'm thinking of was a middle-aged gentleman who walked out into snow, deep snow, in sandals. And he got gangrene of his feet and obviously was not thinking very clearly. And he actually, when I talked with him, he acknowledged that he was not thinking too clearly. So my impression of the gentleman was that he was psychotic, chronically psychotic, and unfortunately, often people who are chronically psychotic, paranoid maybe, may not be very responsive to antipsychotic medication. So that's another aspect. But what would you do if it was your son or your daughter and they have a mental illness and they're dangerous to themselves? Gangrene of the feet is a big problem. So we're dealing with people who often make bad decisions, either due to psychiatric illness, like conventional psychiatric illness like schizophrenia, could also be related to autism, could be related to intellectual disability. In my opinion, this whole issue is not black or white. Let's say if someone is injecting heroin chronically, and not uncommonly, people who do that may be depressed, under a lot of stress, socially, financially, and often may not care really if they survive injecting heroin. They may not get the heroin from someone reliable, so they don't really know the dose to take. So often people may inject heroin without necessarily caring if they survive. So are those people we need to lock up against their will in a psychiatric hospital? Difficult decisions, in my opinion, and I try and judge things on a case-by-case basis, use my best clinical judgment as a psychiatrist, but very difficult situations. And I think the key thing is someone thinking clearly? Do they have a psychiatric illness? Are they severely depressed, psychotic? Are they delirious? Demented to an extent where they cannot make good decisions? And again, this is not a black or white issue, because someone who's autistic may be able to make very good decisions. Someone who has intellectual disability may be able to make good decisions. And the same, someone who's schizophrenic may be able to make good decisions. So blanket statements are really not necessarily possible. And we, in my opinion, need to look at each situation, each patient on an individual basis and make our decisions. But again, this whole issue is, to me, interesting but very sad, because we don't want to be overly paternalistic, but also it's very sad to see a gentleman with gangrene of his feet due to psychotic problems, and we did not intervene in time. He did not get help in time. Thank you very much.